Hello and welcome to I Got You, your go-to for honest, simple conversations about vision, eye health, and general wellness. I'm your host, Dr. Valarie Jerome, optometrist and total eye nerd. No jargon, no hype, just real talk, grounded in care and expertise. Because your eyes matter, and so do you. This is a space where you're going to feel heard, seen, and supported, and you're going to get some information that you can actually use. So don't worry, I got you. Today we're going to have an eye on menopause. We're going to be talking about your hormones or lack thereof and how it is affecting your eyes and vision. Now, every female, if fortunate to live long enough, will go through perimenopause and menopause. And this is just an honest fact of life. And just like most changes to our bodies with age, while it might vary from how it affects one person to another person, there are some changes to the body that all of us women go through when we go through menopause. So what is menopause? Well, it's really defined as going 12 consecutive months without a menstrual cycle as a result of the reduction and the loss of ovarian reproductive function. Now, perimenopause is this sort of ill-defined time, but in those years before menopause, and that could be up to about 10 years, when your hormone levels decline and all those symptoms of menopause begin to appear. But if it were just as simple as those two statements. So let's talk about some symptoms of perimenopause and menopause. Some you might know and some you might not know. Well, there's hot flashes. So these hot flashes, these flushes, listen, if it were only just that, it'd be easy, but that's the big one people think of. There's night sweats. There's fatigue. There's tender breast. There's insomnia. Oh, I know that all too well. There's weight gain. There's increased visceral fat or belly fat. There's hair loss and changes to our hair. There's memory loss, that dreaded brain fog. And it's so much worse than baby brain, in my opinion. There's vaginal and urinary bladder issues, infections, incontinence. There's mood shifts. There's reduced libido. Oh, the list just keeps going on and on, doesn't it? There's increase of health conditions, increased risk of health conditions like high cholesterol, high blood pressure. There's an increased risk of stroke and heart attacks. There's digestive issues. There's bloating. There's migraine headaches, dizziness, tingling in your arms, your hands, your legs, your feet. There's joint pain, muscle ache, osteoporosis, heart palpitations, weak or brittle nails, taste changes. Yeah, I read that one. I thought, really? But taste changes makes sense. Happened to me. There's new body odor. Just when you thought you couldn't smell, you get this new smell. There's new or increased allergy symptoms. Then there's the dry and itchy skin. There's the dry eyes, and there's the dry everything. Did I forget anything? That was a lot. Well, in full disclosure, at the time of this recording, I am in the perimenopause phase of my life. And while I can't say that I've had every one of those symptoms, I've had my share of more than I'd like to on that list. My perimenopause was first treated with antidepressants because that's what my doctor and me, that's what we thought was happening. We thought I was depressed. But quickly I realized that it was more once I began to read more online during lockdown. There was some perks of lockdown, right? Now, at one point my insomnia was so bad. I mean, some nights I may have, if I got an hour of sleep, that was lucky. And on an hour of sleep, I couldn't give my patients 100% of me the next day. And then there's the brain fog. Now, this was the really scary thing. The brain fog made me feel like, am I getting dementia? It made me forget the names of friends. It made me forget my friend's kid's name. Not just where I left my keys. It was so much more than that. Now, when it was at its worst, I actually forgot a medical term when I was writing a referral letter. I had a patient sat next to me. I'm typing up a referral letter, and I couldn't think of the word. I had to write blood in the anterior chamber. Of course, it was hyphema. I know hyphema, but I could not think of the word. And another full disclosure, I am no expert on the treatment of menopause when it comes to nutrition, exercise, or hormone replacement therapy. But at the end, I will give you some of my recommendations for sources and people that helped me And I'll mention that towards the end of our time today. Today, I'm going to be talking about menopause and its effect on our eye health and our vision. Do you know, one of those symptoms that we talked about above is eye-related, and that's dry eyes. So we're going to talk about that today. That's why I'm here today. But I want to let you know, it's not just dry eyes. Your hormones completely tanking does so much more than just cause dry eyes. I'm going to chat a little bit about that with you today. But let's talk about dry eyes and hormones first. According to some research, about 2/3 of all menopausal women are going to have dry eyes. These changing hormone levels, they affect our tears. They reduce the quality and the quantity of our tears, and they make our tears evaporate a little bit too quick. Now, we know that losing estrogen is linked to more inflammation, a rise in inflammation in the body. And it's inflammation for most dry eye patients that is the root cause of the problem of their dry eyes. So let's talk a little bit about that. Now, inflammation causes these oil glands all along the bottom and all along the top to produce less quality oil to help mix in with the water tears to hold the tears on the eyes. So this lack of quality and quantity of the oil makes our tears evaporate much faster. There's also studies looking into the loss of hormones and the effect on the lacrimal gland. So this is the gland that makes the water part of our tears. Now, that's a little bit about the front part of the eye. Let's move inside the eye to see what else is suffering when we start to have those dropped levels of estrogen. Interestingly enough, not too long ago, about the 1990s, researchers actually found estrogen receptors on the lens in the eye and on the retina in the back of the eye. So, ladies, this is yet another thing that we need to look at when we're dealing with menopause. Now to the lens in the eye. Yep, I'm going to be talking about the C word in my profession, cataracts. With the onset of menopause, when those estrogen levels plummet, the incidence of cataracts in women gets higher than with men at that age. Now, let's chat about the very back part of the eye, the retina, and how hormones affect it. So we know that estrogen helps with better blood flow. And we have some pretty important structures in the eye, some pretty important parts of the eye that need really good blood flow. Research is suggesting that estrogen has a neuroprotective effect on the retina, that's the back part of the eye, and the optic nerve. That's what sends the information back to the brain. So what's neuroprotection, you ask? Well, think of it like fiber optic cables with good insulation around them, helping that information process faster and without any disruptions. And that's what neuroprotection does for the eyes. The retina captures information and the optic nerve sends that information back to the brain for it to be processed. Now, if the retina lacks good protection, well, you could see changes like macular degeneration. And if the optic nerve lacks protection, you need to be worried about glaucoma. So sorry to be the bearer of bad news, but the reduction of female reproductive hormones may increase your risk of getting glaucoma. And glaucoma is a silent disease of the eyes that can completely rob your vision. So as a perimenopausal or menopausal woman, what would I advise you to do when it comes to your eyes? Well, just like I say in every other podcast, nearly everyone I think, have those routine eye exams. So early prevention is key. And get screened for dry eyes at those routine eye exams. So find out the type of dry eye you have and if there's any gland issue involved. Because knowing the type of dry eye that you have will allow for a more bespoke treatment of your dry eye issues. And please let your eye care provider know if you are in perimenopause or menopause. Make sure to let them know if you're taking HRT. That's something that we need to know. And look, if you have any issues with your eyes, not looking, feeling, or seeing their best, get seen as soon as you can. So I know I promised I'd share with you. So here are some of my resources, what really helped me in my perimenopause journey so far. And these are, again, they didn't pay me to say this, but I'm just going to mention their name. There's Dr. Mary Claire Haver. So she's an OBGYN from America, and she is the author of a great new book called The New Menopause. There's Dr. Vonda Wright. She is an orthopedic surgeon from the U.S., and she's an author of another great book called Unbreakable. And then there's also Dr. Louise Newman, who's a GP and menopause expert, and I absolutely love her podcast. And this is not a paid advert. None of these ladies asked me to say their name. I completely did that of my own free will. But hey, if they want to chat about dry eyes in their menopause group, I'm here, ladies. And like so many things that happen to our bodies, our eyes are impacted by this condition, perimenopause and menopause. So I always say knowledge is power, and I'm here to empower you with knowledge wherever I can. Thanks for listening. Thank you so very much for listening to the I Got You podcast with myself, Dr. Valarie Jerome. Just a little reminder, everything that we chat about here on this podcast is for info and entertainment purposes only. So if something's a little blurry, itchy, or not quite right with your eyes, book in an eye exam with your eye care provider. Take care of yourself and take care of your eyes.